So again, tying into this whole idea about baroreceptor and why it's relevant, we already had one video that discussed why baroreceptor is important for controlling, taming, and it's sort of like a circuit that remembers patterns, just like social media or some of your shopping online remembers what you've done before. Your body remembers adrenaline and will keep giving you adrenaline. So the baroreceptor is part of a ties into why you might have POTS or how your body responds to POTS. So many causes of POTS may tie into baroreceptor issues or baroreceptor response. So here's our friend again. Again, just not a fake screen in the background. So the baroreceptors are these sensors. You're not going to see any testing on CAT scan or MRI or ultrasound. They're microscopic, and you see them by your autonomic testing or your vitals, how your heart rate responds or your blood pressure may spike to postural changes or through the day of just high heart rates, or even go from low blood pressure to high blood pressure. 20% of people with POTS can have moments of high blood pressure. So these sensors, here's your heart here, your aorta, the carotid artery. These are these sensors that respond to if the blood's not adequately filling the blood vessels and stretching. Baro means stretch properly. If they're not filling, you'll get a spike in heart rate, that tachycardia, and maybe a rise in blood pressure. So the baroreceptors actually send impulses up to the brain, that will have blood pressure and heart rate centers there. So baroreceptor dysregulation can lead to POTS. So let's go through some mechanisms that we can see that POTS can occur from baroreceptor dysregulation. Someone has a concussion, traumatic brain injury, something that affects their brain. There's blood pressure, heart rate centers in the brain, hypothalamus, the medullary centers in the lower part of the brain stem back here. You're not going to see on CAT scan MRI most times. It's clinical. We can see those centers get jarred, injured, and you'll see POTS physiology because of those centers get altered. Often as patients, you'll see high heart rates, even blood pressure spikes. This sort of baroreceptor dysregulation. Some are patients who might have had COVID, where the COVID gets into the lung area, the lungs, the lung chest cavity. Some of the inflammatory cascade in the chest from the virus and the body's response might have jarred and inflamed the baroreceptor and stunned it. And that very stress physiology that the body got sort of stuck due to the virus and leaves the body in a very rendered, stuck, hyper stress pathophysiology stress state, and leaves people in this very dysregulated state. So that's another mechanism that we see. We'll see often people who've been very ill medically from many health issues, that the baroreceptor gets sort of dysregulated, dysfunction, and becomes activated as a physiologic stress state. We've seen people who've been through many illnesses, many physiologic traumas, even life events, where this baroreceptor as a physiologic response gets trigger activated as a sustained response, try and protect you as activated. And that would be a fascinating area of research, why some people versus others become more susceptible, why this happens to some versus others. And there's some theories that we do see. We do see some people who may have had prior neurologic conditions that are more, that shows their bodies are more activated neurologically. People who had migraines or irritable bowel or fibromyalgia or other neurologic conditions that are nervous systems are more reactive, sensitized, maybe more susceptible to a POTS, which is not a very reactive system. But we see people's bodies, when they've just been through so much, just get kindled to another condition. The other aspect we can see is something called neuropathy, which we're trying to figure out exactly what is the occurrence. We found at least 15-20% of our patients who come to us in an autonomic center at a major medical center may have it. Again, that's a filter population that comes to us. We don't know exactly what nationally it means. This is where there's some kind of impairment of the nerve squeezing the blood vessels potentially. So the blood doesn't squeeze, it drops, and that can lead to the baroreceptor then overfiring to compensate. And again, people who have things that can cause that impairment of blood vessels, or people with airless downloads, or at least impairment of blood vessels, autoimmune, inflammatory conditions, many, many factors. But the idea about thinking about how the baroreceptor can either cause it to compensate due to impaired blood vessel squeeze, or how the body becomes traumatized, or where the baroreceptor flows through the nervous system and through the body can become injured or altered, are so important to think about in terms of why someone can have POTS, and also then maybe how treatments can help. So we really appreciate listening to this. And again, listen to this video over and over again. It's a lot of complexity and also a lot of opportunities for future treatments and research opportunities for us. Thank you.